Hey everybody, Dr. Passero here, just tuning in with a few more videos that I wanted to share with everyone. This video series I call Coping with COVID. It's going to be a series of 6 videos and we're going to cover some really important topics. In this first video, I'm just going to give you an overview of what to expect in the coming videos that are coming up. So let's get right to it. In the first video after this, I'm going to be talking about frontline therapies in the management of COVID-19. So from my end of treatment, we're going to be discussing some of the things that I've seen be most useful. Some of these are the more traditional things that we've heard about from the very beginning that at first were somewhat speculative. So what types of vitamins and nutrients may be the most effective? And the exciting news is that there's been some research coming out that's validating the use of some of these vitamins and nutrients in COVID-19. At the very beginning, we were just suspicious, or we suspected that based on their research for other viral illnesses and the way that they impacted the immune system in previous human and animal studies, they'd be useful, but we didn't have the data. And now the data is starting to come out and really validate some of the early recommendations that are proving to be very useful in helping to support people through this. So we're going to review those, and then we're going to review some other things that are a little bit more cutting edge that I've been using in the practice that you're not going to hear about in the mainstream that I've used to successfully help some people really get over and get through COVID-19. Now, these aren't treatments. I'm going to call them supportive therapies. So they're not curing the disease. What they're doing is they're supporting people through the COVID-19 process. And there are a lot of really useful therapies that I feel have been able to help keep people out of the hospital and turn their condition around faster. So that's going to be that video. In videos 3, 4, and 5, I'm going to be covering some very useful and important lifestyle and daily habits that you can take to do 2 very important things. First off, they're designed to help improve your immune system and your immune function. Clearly an important issue when dealing with this pandemic. Secondly, and more importantly, I want to stress and help everyone understand that these at-home daily practices and habits are fundamentally geared at nourishing your overall and inherent vitality on a very deep level. The more vital and healthy you are, of course, the better your immune function is. Some of them are really specifically focused on general vitality, but all of them, I've carefully selected, all the ones that I'm going to review with you, I've carefully selected of ones that have specific implications on benefits to the immune system. We know and understand that, yes, this virus is new. That's why it's called the novel coronavirus. And as a result, most of us, pretty much all of us, don't have pre-existing antibodies, which makes it very dangerous and is why it's spreading so rapidly, or one of the reasons. However, that doesn't mean that our immune system is helpless against it. This is why up to 80% of people have mild symptoms, moderate symptoms, or no symptoms at all. That's because our immune system actually has a way of interacting with the virus, learning how to defeat it, and in some people, defeating it quite quickly before they even develop symptoms. So the function and the functionality and utility of our immune system is critical at this point in time. Yes, we still need to rush to try and develop other therapies and other ways of treating it once people get sick, because there are going to be people, no matter how healthy their immune system is, still fall ill to the viral infection. But there's a huge amount of people in the population that the severity of their disease, or even their chances of getting it in the first place after an exposure, are significantly reduced with their immune system being healthier. Now, the other important side of it is all of these therapies, as I said before, also deeply nourish your inherent vitality of your body. Now, we know that, and we've seen this now in the vast majority of data coming out of the epicenter of the COVID-19 outbreak in New York, that the vast majority of people that are suffering the most severe complications, yes, are the elderly, but aside from that, are people with significant pre-existing health conditions. Hypertension and heart disease is at the very top, as well as diabetes. These are diseases, in my opinion, of poor vitality, usually resulting from poor lifestyle choices related to nutrition, diet, exercise, and literally just how we care for our body. So all of the things that I'm going to talk to you about in videos 3, 4, and 5 are topics you can implement and tools you can implement right away that are easy on a daily basis to be supporting your overall health. And yes, they are also all proven in animal and human models to improve your immune function as well, your resistance to viral infections, and help to reduce inflammation and negative inflammation, which is driven by your immune system. So really important topics, and I want to make sure that in those videos, they're going to be primarily focused on things that are going to be helpful for you. During quarantine, we're all under a significant amount of increased stressors for whatever reason. Maybe job loss, maybe trying to work your job from home, homeschooling kids, being sick, worrying about somebody that's sick. We are all under a lot of stressors. And so I want to assure you all that my messaging to the community and to my patients right now is let's focus on a few things that we can implement every day that are supportive for your health. And let's not spend all of our time talking about all the do's and don'ts and the things that you shouldn't be doing. Because let's face it, when we're under a lot of stress, we do the best that we can to cope. And what I have found is that if people are motivated to start just implementing a few things that are very supportive for their health, they actually start to become more self-aware of the things that they're doing that may not be great for their health. So some really great topics. I've spent a lot of time researching and digging into the different therapies that I've worked with over my past 17 years that are the most useful and supportive for helping your overall health and vitality, and also very specific for supporting your immune system. In video number 6, I'm going to be talking about a very hot topic, which is antibody testing. So antibody testing is now fairly widely available. I know of at least 12 different labs that are offering COVID-19 antibody tests, and people are very excited to get them, myself included. I believe that I was possibly exposed to COVID. I believe I may have had a mild case of it, but I don't know. So these antibody tests can start to be really useful in helping us to understand if our immune system has seen this virus before, which may indicate some improved immune reaction on a future exposure, which is really important as we start working towards transitioning back into a more normal daily routine. Now, this video is really important because there are a lot of shortcomings with the antibody testing. It's very important for people to understand their pros and their cons and how to properly interpret and utilize the results of an antibody test within the general context of what does this mean for me and my behavior. And that is a really important issue. None of these tests available have fully been vetted by the FDA. They are available under EUA status, which is emergency use authorization, where we're able to rush some things to the market and bypass some of the traditional FDA rigorous guidelines to understand how effective they are. And the FDA has approved many of these tests under the emergency use authorization status. And there's a very wide variety of how these labs operate to get the specificity and sensitivity correct for the testing of antibodies to COVID-19. There's different types of antibodies different labs are using. They're testing antibodies to different areas of the virus. Some labs are basing their accuracy on very large sample sizes, which is of course a better database than labs that are working based on very small sample sizes. These are all really important issues. And because I'm going to be offering antibody testing through my clinic starting next week, I really want to give you guys a little bit of education about how we're going to use these tests and how they might be useful for you. So that's pretty much it. In these next videos to come, we're going to be covering all those topics. They'll be released over the course of the next week. So please keep checking the email or my website to keep updated on them. And listen, I am doing everything I can to try and be a positive support for the community at this time when everyone is in need of support related to their health, whether it's anxiety or directly related to COVID-19. So please let me know what you want to hear about. I'm happy to listen to people's suggestions and come up with videos that are the most useful for what the community needs. So I hope these are helpful, and I look forward to educating you all about these topics in the weeks to come. Thanks again.